Female pattern hair loss is a type of hair loss that affects women predominantly after menopause. However, a recent Brazilian study revealed that 8% of women in their 20s experience female pattern loss, and some 68% of women between the age of 60 to 70 experience female pattern loss. The statistics more broadly is that about 40% of women by age 50 will experience female pattern loss. Now, what is female pattern hair loss? Well, female pattern hair loss is experienced typically in the middle part of the scalp to begin with. So you notice a widening of the part, so thinness in the very top part of the scalp, and then in time it starts to radiate down the sides of the scalp, so it's more diffuse in nature, more generalized, rather than a male pattern of loss where you see more of a recession at the temples and more crown loss. Whereas female pattern loss starts in the middle of the part and you get what they call the Christmas tree sign, so you get this widening of the part where the hair becomes finer, thinner, and you see more scalp on show. The way it presents typically is that women do start to notice thinning in the part. This usually coincides with the hair not growing as long as what it previously has. It can lose the pigment to it, so the hair looks a little bit lifeless. Now, why does this happen? Well, female pattern hair loss occurs due to a genetic predisposition to having hair follicles that essentially miniaturize, so they shrink in time. And so what that then translates into is the hair follicle producing finer hairs that are thinner, that grow less long. Why this happens is the follicle isn't able to grow hair for the same length of time in a typical hair growth cycle. A typical hair growth cycle is anywhere from 2 to 6 years. What happens with female pattern loss is it actually can shorten to sometimes a matter of months. So your hair doesn't have the same length of time to be able to grow to its fullest potential. The other thing is that what they've found is that there's actually a delay in the time from when the hair falls out at the end of the hair growth cycle to when it actually starts growing again. So you have lengthy periods of time between that follicle actually producing hair, which is why you can start to see sparse areas on the scalp. You start to see areas where you get these bare zones. Now, despite female pattern loss often getting referred to as androgenic alopecia, androgens being sex hormones like testosterone and estrogen, the majority of women that actually have their hair tested in female pattern loss actually have normal hormones. So they have normal estrogen and some of these other hormones like testosterone. So despite it sometimes being called androgenic alopecia, it's actually more accurately referred to as female pattern loss. How can this be treated? Well, it's really, really important, as always, that you get a diagnosis from your healthcare provider or your physician. That's so important because there are other things that you need to rule out. Even though female pattern loss is one of the most common forms of hair loss in women, you want to rule out other causes of hair loss, and that's most important. Then there is a number of different things that can be done. The most widely adopted approach is to use minoxidil, which can stimulate the growth of the hair and prolong the growth phase. Now, that is effective by itself in a lot of women, but it can also be made more effective when you combine it with some anti-androgenic drugs like spironolactone, for instance. There is a raft of different drugs that can be used off-label, either topically or in an oral formula. Other things that patients use, patients sometimes utilize low-level laser light caps. There is the use of PRP. However, it's about finding out for the individual what is going to suit them from a personal preference perspective, because anytime you start a patient on any drug, whether topical, oral, you have to look at a forecast of, okay, for the rest of their life, if this patient's going to be on this drug, how is that going to fit into their lifestyle? How is it potentially going to impact them? Are they amenable and accepting of the potential side effects from this drug? So it's always really important to understand what the personal preferences are of your patient. So you can do topical treatments, you can do oral treatments, there are stimulatory treatments. HRP is a treatment. We treat a lot of women with female pattern loss. We go through the usual consultation process, and then we work out what are the best ingredients to include in this patient's hair restoration protocol. And we also combine that then with supplements, combine that with mechanical stimulation of the scalp through microneedling. And then we look at the long term and, okay, what's going to be the best topical formula to use for this patient, obviously whilst taking into account the patient's personal preferences. There is a raft of different treatments that can be used to treat female pattern loss, but to begin with, it is most important to get the diagnosis, which will then set you up for the best success thereafter. If female pattern loss is something that you struggle with and you want to look into what available treatment options there are, feel free to book a consultation online, follow the prompts below, and then we can connect you with one of our doctors.